October 1st is when you can begin enrolling. That does not mean coverage starts then. Coverage starts in January. So that is a good point. There's not really a need to rush right in. But generally, these are private insurance plans. These are not government plans. So I think the 3 providers so far in Oklahoma that have posted, Blue Cross.
I think there are 5 altogether, two HMOs and 3 other carriers.
There are carriers. And so there will be all different types, generally what they consider bronze, silver, and gold level type of plans. The bronze would be more sort of generally what we're used to as sort of the more high deductible catastrophic type of coverage, so won't cover a lot of costs for doctor's visits and pharmaceuticals, but if something really bad happens, most of your costs at the hospital will be covered all the way up to the other end of the spectrum. The one thing that I think is very important but that doesn't get sort of reported a lot is for people at different income levels who go to the exchange to purchase a plan, there are tax credits from the federal government that are available that they are eligible for that will reduce the monthly premium. And so this is where it gets a little mathematical, so I'll just try to be very simplistic. Those tax credits start for people at 100% of the federal poverty level. Not at the federal poverty level, but 1 times the federal poverty level. So 100% of the federal poverty level up to 400% of the federal poverty level. And just to give you an idea, if you're a family of 4, so 2 parents and 2 children, 400% of the federal poverty level is $92,000 a year. So the tax credit that you'd be eligible at that level will not be as generous as it is for those people at 100% of the poverty level, which is a poorer income bracket. You have the option when you sign up on the plan. So you find a plan that you think is a good fit for you, and I don't really know why a consumer, frankly, would not choose this, but there may be some that aren't. You have the option to have the tax credit incorporated into your cost. So say it's a $325 monthly premium, and once they put your tax credit in, it reduces it to $275. When you choose that, you pay $275 a month, and then the private provider, the insurance provider, works with the IRS to get the credit. You don't have to deal with it on your tax return and that. So